like to talk to you a little bit today about taking vital signs on a horse, and before we can talk about the individual vital signs, I need to talk to you a little bit about why you might want to be able to do this and why this information might be useful to you when you are communicating with your veterinarian, and particularly if you're in an emergency situation and you're needing to give the veterinarian information over the phone about the condition of your horse. One of the things that is useful to a veterinarian when we're talking about situations like colic, for example, are what is the heart rate, and what are the gut sounds, and what are the mucous membranes look like in the capillary refill. So those are the important things that we want to talk about today. Hydration is another one, and I'll show you how to do that as well. Well, the first thing, of course, that you're going to be asked is, do you know what the heart rate is? So if you have a stethoscope, it's the easiest way to do it. Take the stethoscope, apply it right here into the armpit, right behind the elbow, just up above the sternum. Apply the stethoscope so that you can hear the heart. And what you want to listen for is a lub-dub, lub-dub, lub-dub. Each one of the lub-dubs is a beat, and if you take your watch and you listen to the lub-dubs and you count the number of lub-dubs that occur within a 15-second period, then what you'll find is that you'll come up with a number. This mare right now is doing 7 beats in a 15-second period, and so if I multiply that by 4, then I come up with 28 beats per minute is her resting heart rate. What are the normal rates for horses? Well, horses at rest out in the pasture will oftentimes be down in the 18 to 22 beats per minute range. When there's a person around, they're usually in the 24 to 36 beat per minute range. Horses, because they are prey animals, can actually jack their heart rate up almost instantaneously when there is a threat or a danger, and that can go up as high as 60 beats per minute. Horses that have rates that are higher than, say, 60 beats per minute probably are in trouble. Particularly if there are no stimuli around, those horses are having a problem, and it could be a colic, it could be other things. But just to let you know that that is the general range for healthy horses at rest is in the 28 to 44 beat per minute range. Now, another question that the veterinarian might ask you is, what do the gums look like, or what's the capillary refill time? The way you do capillary refill time is just gently lift the lip so that you can see the mucous membrane. Look at the color, and the color should be pink, and the gum should be slimy and wet. If you find that the gums are tacky, that's an indication of dehydration. If you want to know what the capillary refill time is, you take your thumb, push on the gum to blanch the gum, and then watch the number of seconds until it refills back to the pink color. This is about 1.5 seconds. Normal range is 1 to 2 seconds. When they begin to get up into the 3 and 4 second range, then you have dehydration, or you have some issue, particularly with circulation, possibly complicated by colic, that will compromise the refill time on the gums. Another question that you may be asked is, what is the hydration status? And I mentioned to you earlier that when the gums are tacky, then that is one indication of hydration. If you pinch the skin right over the point of the shoulder, this is recognized as being the ideal place, and it goes back immediately as it does with this mare, then that is normal hydration. When the skin stays pinched up like this for some period of time, as in seconds, and goes down very slowly, then that is an indication of dehydration. And the number of seconds it takes to go back down flat is an indication and would be useful information to your veterinarian, is hydration. Another way to evaluate hydration is to pinch the skin right over the eyelid, the upper eyelid, and watch it go back down to normal. That too is another way to evaluate hydration. And then and that will get you most of the information that the veterinarian would need about hydration. If the veterinarian asks you, does she have gut sounds, and if you have a stethoscope, then you just simply come back to this area, listen along the flank. You listen high for 4 or 5 seconds. You move to the middle, 4 or 5 seconds. Move to the bottom, 4 or 5 seconds. And if you don't hear gut sounds in any of those areas, you stay a little bit longer, up to 10 or 15 seconds per spot. And the number of growls or borborygmi that you hear in a period of time is an indication of the status of the gut function. It is important that you listen to normal gut sounds so that you know what those sound like, so that you can give that information to your veterinarian if you are having, for example, a colic situation. You need to listen on the near side as well as the off side and be able to give that information to a veterinarian. Now, those are the general signs that should be collected when we talk about vital signs, and that's the information that you'd need to relay to your veterinarian if you're in an emergency situation.